Hello, my name is Brian and I'm a urology PHO at the Princess Alexandra Hospital. Today, we are going to look at the national trends in the pharmacological and minimally invasive surgical management of overactive bladder in Australia. I do not have any conflict of interest to disclose. Overactive bladder is a symptom-based clinical diagnosis which is characterized by urgency, frequency, nocturia with or without urge incontinence in the absence of infective or irritative factors. In Australia, population studies are notably absent, and the prevalence of OAB is yet to be accurately defined. However, in European and American cohorts, it has been reported as high as 16% in the adult population over the age of 40. OAB can have a profound impact on patients' quality of life. In addition, its societal impact in Australia is substantial, with a $66.7 billion financial burden owing to urinary incontinence alone. Currently, there are multiple tiers of treatment available for overactive bladder in Australia. It is, however, unclear how the advent of these therapies have changed the overall management patterns of overactive bladder. This study therefore aimed to describe the changing landscape in the medical and procedural management of OAB in Australia over the last 2 decades. Data from the Australian government pharmaceutical benefit schemes as well as the Medicare benefit schedule was sought. The items report were queried per calendar year from January 1992 to December 2020 for the following therapies as described on the slide. Figure 1 reflects the medical therapies prescriptions. The prescription rate of peroral oxybutynin has steadily risen from 17,000 in 1996 to 282,000 scripts in 2020. Its patch version shared a similar sequential increase rate of prescription since its introduction in 2009, but at a lower frequency. By contrast, prescription rate for propanthyline, which was the first OAB therapy on the PBS, has progressively been declining over the years. Table 1 demonstrates the absolute number of minimally invasive surgical procedures for OAB in Australia by MBS item numbers. There were 40,075 OAB-related procedures performed cumulatively in Australia over the time period. From the inception of SNS in 2010 and further addition of botox and PTNS on the MBS, there have been a 99.3% increase in the rate of uptake in procedures from 2010 to 2020. The annual rates for OAB-related procedures are demonstrated in Figure 2. Across the years, there have been a progressive increase in all procedures. The most standout trend was observed after the 2018 introduction of PTNS. Figure 2 also showed time slot of addition of key drugs to the Australian market. In 2010, darafenacin was approved for use by the TGA, followed by sulfenacin in 2014, myriad in 2019, and in 2017, botox was added to the PBS. Despite these changes to the pharmacological landscape of OAB management, it did not signal a particular change in the rates of minimally invasive procedures. Next, sacral nerve stimulators rate were consistent over the last 10 years as seen in Figure 3. There were equal numbers of SNS lead placement and SNS generators across the years. The rates for SNS remain stable despite the availability of PTNS. In comparison to SNS, PTNS use has increased dramatically since its approval on the MBS in 2018. PTNS trials rose from 118 in 2018 to 7,143 the following year, representing a staggering 6,000-fold increase. In 2020, amongst all minimally invasive procedures, PTNS stood out as the most commonly performed procedure, comprising 70.4% of total absolute number of procedures that year. The uptake of minimally invasive procedures differed across various states and territories. From 2013 to 2016, only SNS and botulinum toxin were available as third-tier therapies. SNS was mostly performed in New South Wales, Victoria, Queensland, and South Australia in approximately similar proportions. Over that period, botox was preferentially performed over SNS across all states except Tasmania. In contrast, there was a reduction of SNS across all strains, with a trend towards a higher uptake of PTNS. This recent study examined the national OAB management trend in Australia and demonstrated how the management option for OAB has significantly evolved for the last decade. Over the years, there still remains an increase in oxybutynin prescription despite the introduction of other OAB medications in Australia. Additionally, there was no change in the trends of minimally invasive procedural treatment despite the various introduction of other OAB medications. Patients with bothersome LUTs with intolerant side effects to oxybutynin may benefit from a government-subsidized intermediate oral therapy. Amongst a minimally invasive procedure, PTNS stood out as the most commonly performed procedure in Australia since its introduction on the MBS. Further research into possible drivers for variation in minimally invasive surgical procedures uptake and distribution of service across Australia will be interesting and may direct future Medicare planning. Thank you for listening to my talk.